Have you ever gone to therapy, or do you know somebody that has gone to therapy? Well, today we're going to talk about what therapy is, and specifically mental health therapy. So what is it, and does it even work? So what is mental health therapy or counseling? And does it work? I am a therapist, and I've done that for about 25 years. And oftentimes people ask the question, well, what do you do in therapy? And does therapy really work? And that was one of the questions that one of our subscribers asked on this YouTube channel is, what is therapy and does it work? So we're going to talk about that today. And I'm going to share with you what my beliefs about therapy are. They may be a little bit different than maybe what the field of counseling would say or what some professionals would say. But this is my experience. So I believe that there's no magic in therapy. And that's because nobody can make anybody else change. So there's nothing that therapy can do to make another person change. So what is therapy? I believe therapy is education, it's information, it's about relationships and building rapport or creating influence so that the information or the knowledge that you have may be listened to by the person that you're talking to. So in many ways, having a good friend that you can talk to and share the things that you're struggling with and get ideas and feedback from them, in a sense, that's therapy. Reading a book and getting information from a book could be considered therapy. Watching a movie or a podcast or anything like that could be considered therapy, in that it's information that can help you think about things differently that would result in a change in your behavior. Now, it may not be the definition for insurance purposes or licensing purposes, but as far as what therapy does, it's the same thing. The goal of therapy is to help an individual change their behavior or change their thinking or change their emotions in such a way that they experience more happiness in their life. So there's a joke that I kind of like that says, how many therapists does it take to change a light bulb? Well, only one, but the light bulb really has to want to change. And that's kind of the way this is. So principle-based living, we talk about principles. Those are laws that whether you believe them or not, agree with them or not, they're true. And one of those principles is the principle of control. And that says that I have control over my thoughts, emotions, and behavior. And that's it. And nobody else can control me. So nobody can make me do anything that I don't want to do. Nobody can make me feel anything that I don't want to feel. Nobody can make me think something that I don't want to think. Now, at first you may consider that and go, I don't know if that's true. But if you think about it at a deeper level, you will know that that's true. So think about then, why do people go to therapy? And I think there are three reasons why people go to therapy. So the first one would be, and this is probably the least frequent of the three, they go to therapy because there are some areas in their life that they're uncomfortable with, that they want to be different, and they're going to therapy to learn more about themselves so that they can change. The second reason that people go to therapy is because they have someone in their life that's creating some problems or challenges for them, and so they're going to therapy to figure out how they can change the other person. And then the third reason that people go to therapy is because somebody's telling them that they have to go. So it's a parent sending a child, or it's a court ordering an individual that they need to go to therapy. So think about that. If I'm going to therapy because somebody is making me go, now we can look at that a little bit deeper too, and that is, nobody can make a person go to therapy. It's still their choice. But if my belief is that I'm going because I'm being forced to go, well, what happens in your life when somebody tries to make you do something that you don't want to do? Do you just gladly change your mind and say, okay, I didn't want to do this, but now I'm happy to do it? Or do you tend to resist? Most often when we feel like someone's trying to make us do something that we don't want to do, we tend to resist. And so that's why oftentimes when people go into therapy that don't want to go, they're going because they have to go. They go in already with the mindset of being resistant, because the belief is I'm going here and somebody's going to try and make me change or make me do something that I don't want to do. And I'm going to prove to them that you can't make me do it. So working with an individual who does not want to be in therapy, typically not very successful unless that relationship and that environment can be changed. So the goal of therapy then would be to create a relationship with that client so that there's some trust between the therapist and the client, or create a need for the client. So help change the client's perspective so that they see their situation differently than they did when they came in, to where they see some benefit to them from making the changes. And if you can get away from a power struggle, so I'm not doing this because somebody else is making me do this, I'm doing it because I want to do it, then we're much more likely to see a person change in therapy. So the second reason I talked about why a person comes into therapy is because they're unhappy with somebody else in their life. So oftentimes this will occur, with a spouse in a relationship that's unhappy with their marriage. And so they'll come in because they don't like what their partner is doing or not doing. Oftentimes they'll come in and they'll want to talk about everything that person is doing. How effective is therapy going to be in changing the person that isn't even there in the office? So not effective at all. So as long as that focus stays on the person that isn't there, and if the person coming into therapy is in kind of a victim mindset where they're blaming their life and their unhappiness on someone else, that's not going to work. That's not going to change. And so in that situation, if you want therapy to work or there to be a benefit in therapy, then the focus needs to shift to the person that's in the office that's coming there for help, and for that person to begin to look at themselves and to say, okay, I don't like what this other person is doing, but I have no control over that. I only have control over me. So I have a choice now, another foundational principle. I have a choice about what I want to think, about how I want to feel, and what I want to do. So if I'm in a relationship with somebody else, well, I have a choice, first of all, of whether I want to stay in that relationship or not. I also have a choice about how I want to feel, even if nothing changes in that relationship. So that person could continue to be non-communicative. They could continue to be messy. They could continue to be a workaholic, or whatever it is that annoys me or bothers me about that person. But I could change the way I see it and the way I feel about it, and as a result, change my experience of being in the relationship with that person. Now, here's the cool thing, though. If this individual changes who they are and how they respond and how they behave towards this person, it's impossible for this person to remain the same. So this person will begin to change, but not because somebody is telling them that they have to. They will just notice and feel something different in the relationship. And oftentimes, if I change for the better, so I'm doing things that bring more happiness into my own life, I'm focused more on me and I'm taking control of me and I'm doing less blaming of others, what you will see is the behavior in the other person will begin to change for the better. Now, sometimes it may change for the worse, and if that happens, then the relationship will kind of take care of itself and it may end, on its own. And then the third reason is a person comes in for therapy because they recognize that there's something in their life that is not the way they want it to be. They recognize that they are creating it or influencing it, or they have something to do with it. And so they want to learn some new skills. They want to gain some new knowledge. They want to gain some techniques, some things that they can use to change themselves in order to change their circumstances or their overall life. So to answer the question again, what is therapy? Well, therapy is information, it's tools, it's education, it's anything that can help a person change. And is therapy effective? Well, it depends. The truth is, therapy doesn't change anyone. All it can do is create an environment and provide information and tools for a person who's in the place that they want to change to use those tools or to use that knowledge to make the change in themselves. Thanks for watching today. Be sure and subscribe to our channel. Ring the bell so you'll get daily updates of new videos. And if you want to know more about who we are and what we do, visit our website at principlebasedliving.com. And if you're watching this on LinkedIn, be sure and follow me here.